In the heart of Lesotho, a small landlocked country in southern Africa, a 15-year-old girl named Lerato presented to the local clinic with a seemingly impossible truth: she was pregnant. Lerato, who had never engaged in vaginal intercourse, vehemently insisted that her only sexual experience had been oral sex. The medical staff, initially skeptical, were baffled. How could a girl, untouched in the traditional sense, find herself carrying a child? The mystery deepened as doctors confirmed Lerato's pregnancy and her claims of virginity. This unlikely case challenged everything they thought they knew about human conception. The doctors delved into medical literature, searching for any precedent or explanation for such a phenomenon. They consulted with experts worldwide, hoping to find a clue that could unravel this medical enigma. Slowly, a theory began to form. Could it be possible that sperm had somehow traveled from Lerato's mouth to her reproductive system? Though highly improbable, the theory suggested that sperm could have entered her bloodstream and found its way to her ovaries. When the doctors explained this to Lerato and her family, they were understandably shocked and confused. Lerato's emotions were a whirlwind of disbelief, fear, and curiosity. How could something so extraordinary happen to her? The medical team reassured her that they would provide the best care possible, despite the unusual circumstances. This case not only tested the limits of medical knowledge, but also highlighted the importance of compassion and understanding in healthcare. In the quiet hills of Lesotho, Lerato's story became a testament to the mysteries of the human body and the resilience of the human spirit. As she left the clinic with her family, Lerato knew that her life had changed forever, but she also knew she wasn't alone. The journey ahead was uncertain, but with the support of her family and the medical team, Lerato faced it with newfound strength and hope. This was just the beginning of an incredible journey that would challenge science and touch hearts. A thorough examination revealed a crucial piece of the puzzle. Lerato's medical history had been a mystery for years, with symptoms that puzzled even the most experienced doctors. Lerato had a rare condition known as distal vaginal atresia. This condition, present from birth, meant that her vagina was closed off, creating a physical barrier between her uterus and the outside world. This congenital anomaly is characterized by the absence or closure of the distal part of the vagina. In Lerato's case, this meant that the lower part of her vaginal canal was completely blocked, preventing any normal menstrual flow from exiting her body. Distal vaginal atresia, while uncommon, is a well-documented condition. Medical literature describes it as a rare but significant reproductive anomaly that can have profound implications on a woman's health and quality of life. It usually results in the accumulation of menstrual blood in the uterus, a condition known as hematocolpos. Hematocolpos can cause severe pain, swelling, and even infections if not treated promptly. However, Lerato had never experienced any menstrual irregularities, adding another layer of complexity to her case. This anomaly in her symptoms made it difficult for doctors to diagnose her condition accurately. Doctors confirmed the diagnosis through imaging scans, which clearly showed the obstruction in her reproductive tract. Advanced imaging techniques like MRI and ultrasound were crucial in visualizing the extent of the atresia and planning the appropriate surgical intervention. The surgical team prepared meticulously for the procedure, understanding the delicate nature of the operation. The goal was to create a functional vaginal canal, allowing normal menstrual flow and preserving Lerato's reproductive health. The surgery was a success, and Lerato's recovery was closely monitored. Post-operative care included regular checkups and physical therapy to ensure that the newly created vaginal canal remained open and functional. Today, Lerato leads a normal life, free from the complications that once plagued her. Her case highlights the importance of early diagnosis and the advancements in medical technology that make such life-changing surgeries possible. Distal vaginal atresia, though rare, is a condition that can be effectively managed with the right medical intervention. Lerato's story is a testament to the resilience of patients and the dedication of medical professionals in overcoming even the most challenging medical conditions. As the medical team delved deeper into Lerato's history, a startling event came to light: a stabbing incident 6 months prior. Lerato had been walking home alone one evening when she was attacked by an assailant who stabbed her in the abdomen. The wound, although serious, had not been considered life-threatening at the time and was treated at a local hospital. She recovered, but the experience left her deeply traumatized. The connection between the stabbing and Lerato's pregnancy began to dawn on the medical team. They were initially perplexed by the unusual circumstances surrounding her condition. How could a seemingly unrelated violent incident lead to such an unexpected outcome? Could the stab wound have created a passageway, bypassing the obstruction caused by her distal vaginal atresia? This rare congenital condition, where the lower part of the vagina is absent or closed, typically prevents sperm from reaching the egg. The team pondered over the possibility that the knife wound might have inadvertently created a new route. The team hypothesized that the attacker's knife had pierced through Lerato's abdominal wall, creating a direct route from her digestive tract to her reproductive organs. This theory, though unconventional, seemed to fit the unique circumstances of her case. The knife wound, they speculated, might have connected her stomach to her reproductive system in an unprecedented way. This, coupled with her rare condition, presented a scenario where sperm from oral sex could have traveled from her stomach through the newly created passage and directly to her fallopian tubes. The medical team considered the implications of this hypothesis. If true, it would be a groundbreaking discovery in the field of reproductive medicine. They meticulously reviewed her medical history, the details of the stabbing incident, and the anatomical diagrams to piece together this extraordinary puzzle. The case of Lerato's pregnancy, resulting from such an unusual sequence of events, highlighted the incredible complexity and resilience of the human body. Section 5. The impact of malnourishment. Further investigation revealed another critical factor: Lerato's nutritional state. Living in a poverty-stricken region, Lerato had long suffered from malnourishment. Malnourishment, the medical team knew, could significantly reduce the acidity of her stomach. Normally, the highly acidic environment of the stomach acts as a natural barrier, killing off most foreign substances, including sperm. However, in Lerato's case, the weakened acidity might have allowed some sperm to survive. Section 6. Unraveling the mystery, the medical investigation. To confirm their suspicions, the medical team conducted a series of tests, including DNA analysis of the amniotic fluid. As expected, the DNA results confirmed that the father was indeed the boy with whom Lerato had engaged in oral sex. This finding, though shocking, corroborated the team's theory, providing scientific evidence for this unprecedented route to conception. The case, though exceptional, served as a stark reminder of the interconnectedness of various physiological factors. Section 7. A medical anomaly. The case of Lerato's pregnancy sent ripples through the medical community. It highlighted the importance of detailed medical histories, even in cases that seemed straightforward. The seemingly impossible was, in this instance, the reality. The convergence of a rare anatomical anomaly, a traumatic event, and the physiological impact of malnourishment created a perfect storm, leading to this extraordinary pregnancy. Section 8. Ethical considerations and future research. Lerato's case raised a host of ethical considerations. Consent in medical examinations, especially those involving minors with limited understanding of their own anatomy, became paramount. The case also underlined the need for sensitive and non-judgmental care, particularly in cultures where sexual health remains a taboo subject. Furthermore, this unprecedented case sparked a wave of interest in the research community. Section 9. Conclusion: a case for the medical books. Lerato's story, though exceptional, serves as a potent reminder of the complexities of the human body. This case challenged long-held assumptions about conception and underscored the importance of a holistic approach to medical diagnosis and treatment. Her pregnancy, a consequence of an improbable sequence of events, will forever be etched in medical annals as a testament to the extraordinary resilience and vulnerability of the human